Sawadika, this is your host Kusuma Yotha Samut. Welcome to Thailand today. The world is getting smaller. Modern transport means there is virtually no place in the world we cannot reach. As millions of people cross borders every day, there is certain health risk that disease can be transmitted quickly and unexpectedly. Such is the case that MERS or Middle East Respiratory virus, a new kind of virus, has been quietly being spread thousands of miles from where it was first reported. At present, the virus is not considered a health risk in Thailand. But how much we know about the MERS? How can we make sure that we are safe? Thailand today has with us Dr. Pasakon Akarasevi, Senior Expert in Preventive Medicine, Epidemiology, Department of Disease Control, Ministry of Public Health, who is well qualified to tell us about the latest outbreak of MERS virus, its potential impact on Thailand, and how can we prepare for it. Please welcome Dr. Pasakon Akarasevi. He is a senior expert in preventive medicine, epidemiology, Department of Disease Control, Ministry of Public Health. Sawadika.
Sawadika.
Welcome to Thailand today, sir.
Yes, okay. Welcome to you.
Well, the world has recently set up with a new vocabulary called MERS. So what is actually happening?
This is the topic talk of the town.
Yes,
now
at the
today.
moment. Yes.
Okay, it's MERS become from the word Middle East Respiratory Syndrome.
Yes.
Yeah, and we have the COVID that is from coronavirus.
So why, when you say the Middle East, it's moved to Korea already?
It is the virus that infections. So and it's cause of the epidemics in the Middle East.
Yeah.
And it has been 3 years already since 2012. And this cumulative case of MERS occur in the Middle East. And it's transmit to right now 25 countries. It spill over to 25 countries. And the latest is Korea, South Korea.
Okay.
And South Korea is one of the biggest epidemic outside Middle East. So that is one of the health concern in the region and become the topic of health in the world.
That's right, that's right. But because there are many people, actually when we hear about it, we didn't feel it at all. But now, readily, because since closer into Asia, so how we transfer to move on from one to another?
We have to understand the basic of this virus. This virus is originally in the animal. Yeah. And
animal, is that to be camel?
Animal in the Middle East, at first we don't know what an animal is.
Okay.
And then there are epidemiological study to identify the risk factor for those who get infection. What is the risk factor for them? And later, scientists identify that drinking the camel milk is one of the risk factors. Living in the farm, contact with camel is also one of the factors. And living close to the patients, living in the family of the patients become a risk factor. And also, we have learned from the Middle East, some patients get infection because they live in the same room with the former confirmed case. So the infection seems to transmit amongst those who have relatively close contact. And the hospital infection is one of the most important factors as well.
Okay.
And then when the infections, since 2012 up to now, almost 3 years.
3 years, yes.
Yeah, almost 3 years. And then the infections spread
more and more.
More and more in many countries in the Middle East. So the Middle East become, let's say that we call it endemic, endemic country for the MERS coronavirus. And when visitors from outside world go to the Middle East, they sometimes get infection, go to Italy, go to Germany, go to several, even to the Philippines, and then finish. But this time it's go to Korea, because the one person from the Korea visit Middle East, and then after he went back home, and then he got the disease, and then it spread to the new place. So the term spillover is something that important.
For those living in Thailand without traveling to Korea or Middle East, we get such the same symptom. It doesn't mean that
Don't worry.
Don't worry about
Don't
that.
worry about that.
They're only concerned about
because
those.
the epidemic in the Middle East is in those who contact. So the key message is you must have the traveling history to the place that have affected area, because the epidemic in that is confined to the hospital, confined to family and those who have symptoms. And for Korean situation right now, it's confined to the hospital where the patient visit, where the patient is there. There is no evidence in Korea right now that there is epidemic in the community. So don't worry about it. We may be overly concerned, and then get over anxiety in that case.
So I would like to talk about the Thailand situation. We should not be nervous or frantic about this matter.
In Thailand, right now we should not be overly worried, because we monitor the situation in Korea, in Middle East. The risk of the country will depend on Korea can stop epidemic or not.
So what do your doctors think that they can do? Because such advanced, they have advanced technology for that.
Right now in Korea, the government, the public health officer and public concern is very strengthened, very high, and the effort that they put in. They put great effort in terms of tracking patients, try to ask the people to voluntarily stay home, close school, over 2,000 schools stop, and then many hospitals do the job like this. So we think that's at this level of public health measure. It will see this week or the next week will be the critical period. So if they pass this week and next week, we are passing 14 days.
14 days, yes.
Yeah, we are starting 14 days, and then if we are passing 14 days with less people infected, then the situation can be controlled.
So we're looking out for those who return from these countries. Soon after they arrived, what do you do to them?
The people who are alive or maybe Thai tourists, or Thai traveler, go to Korea and then come back.
After we return from Saudi Arabia.
Or Saudi Arabia or South Korea, whatever.
What is your measure to do it?
This is important question. Okay, the first thing, report to the public health.
First?
If you have symptoms.
If you're not?
Upon arrival.
Upon arrival.
Upon arrival, you will have the health card.
All right.
Health card, and you have to
fill up
and say something about your health in the health cards. And then the health card will be with the health officer at the airport. We will know who has come back from the affected area.
Okay, because they will be shaping up.
Yes. And this will be computerized some way, and to sort out how many people go and come back. Okay. And then when you come to pass the immigration, so the immigration officer will notice, will try to look at if this is well or not. And there are another measure that is we call thermal scan. Remember that the symptom is fever. You have 38 degrees or 30 or more than. The infrared detector will show the picture of anyone who have high temperature. It will show the picture. So the health will interview more. And before interview, they will put masks
Oh, really?
Yeah, they should put mask.
Put mask to the patient
to,
or
for the traveler.
To the travelers
And
themselves.
so put a mask on and then ask them, where do you go? What is your symptom? We have to screen. If you go from the place where, if you do contact with the animal,
Did
you
you
go to
drink any
farm,
milk?
you drink
Camel
milk,
milk?
or you went to the hospital, went to the clinic, because that place is the likely place that the transmission will go on. And then if there are something that we should investigate more, then the health officer at the airport, I mean all airport, Chiang Mai,
On this
not
international,
only, on international, six
Six
international airport in Thailand, they will, the health control will screen, and then if we need transfer or refer, we will have decided hospital. Yeah, decided hospital, and because we went to isolation room, take the blood sample, take the respiratory sample, and to test. Okay, the test can be as quickly as 1 day, 2 days, so that the action can be done. And then you are not going alone, do you? Something like that. We have friends, we have wife, family, spouse, and whatever. So we have to record. And then if during while we are record and while waiting for the laboratory result, we ask them to stay home, observe your symptoms, and we may ask some local health officer to contact you.
At this minute, do we have any medication to treat them?
There are no direct medication for treatment of MERS coronavirus. We usually take care about general symptoms like hydration, and then eating, something like that, to keep the body and reduce the temperature by using antipyretic drugs like paracetamol or something.
Is that enough?
Usually enough, but some case because of dehydration, the fever can go too high. And the other important thing is to monitor the oxygen level, because we have to detect that this is go to we call the condition of pneumonia or not. Yeah, because it go to the lower respiratory tract, it will be rapidly. Okay, and the danger is the people who are more than 50.
Okay.
Yeah, elderly, or people who have renal failure, or some of the conditions like diabetes, hypertension, heart disease. Okay, that will be difficult, because those who are have high mortality rate is associated with the other concurrent illness.
And also because of that age, those ages, the lack of resistance, strong resistance for that.
And the body is respond to infection. It's not.
So can you run down how does the virus spread?
The virus spreads by droplets. Let's say droplets. You sneeze, you cough, and in the hospital, if you use the respirator, you do some vacuum suctions of the sputum, of the secretion, and they could spread like that. So washing hands,
every time,
using masks, and use the protection. So the hospital infection control is very difficult, and is the most important factor, because when the people have the patients have the symptom like this, during they have the peak of fever, peak of symptom, the number of virus is high. So density or concentration of virus is high. So in hospital setting, that is, or during the full-blown of disease, the number of the virus. So the transmission depends on stage of the patients, depend on what are you doing with the patients. Have you do the protection of yourself or staff? Do we have standard procedure to take care about hospital infection control? That is the very important. And then oxygen therapy, we give the IV fluids, intravenous fluids. And sometimes we can give antibiotics. to prevent the superimposed infection. Sometimes we have to use some of the other antivirus because there may be co-infections as well. So the blood test and everything should be done.
So until this minute, do we you are in the field of the medication. You may have the doctor yourself. So among your group, you should be knowing that your colleagues and your also institute must be knowing that. Is that under control? I mean, it can be easily controlled.
Right now we watch carefully because the situation in South Korea remind us that we have to strengthening. Sometimes small pitfall can get big problem. Yeah, that is where we have to be careful, and then to correct all the pitfall. Otherwise, we have something like this. We have something like this is the manual for the medical staff, health nurse, and anybody who work with this. So this is the manual come out 3 years ago.
Oh yes.
And we continue to update.
I see. So in here you have what? You have the form actually.
We have form, we have guideline, we have instruction what to do this and that, and we have the guideline for report, guideline for notification. And because one thing is that we have to use communication technology to detect immediately. So we have to detect in 24 hours.
Yes. Okay. Oh, very interesting.
And then let the epidemiological investigation team to go to, and we ask for the cooperation, send like this to every hospital.
Yes. Yeah. So this meant for the medical practitioners.
Yes.
For this matter.
Because we think that's we have to our vision that we have to fight coronavirus for a long period of time. Not just South Korea case. It may be the next. We may be the next as well.
Let's cross our fingers.
Yeah, very complicated. So the key is to prepare ourselves.
Yes.
To prepare ourselves. And prepare is the process of preparation for continuing.
So the medication itself, the medicine is only the paracetamol needed, or is there any other needed to be used?
Yeah, the medication is to reduce the fever, to give hydration.
All right.
To keep enough hydration, and also keep the level of oxygen. Combat superimposed infection.
Yes.
We may use antibiotic as it indicates. And also we can have to treat the underlying disease as well. If you have diabetes, take care of diabetes. If you have asthma, we take care of asthma. So don't let the underlying disease aggravate. And then they keep. If then the body will mount the immune response. So that most of the people, most of young people with MERS, they have strong immune to combat and to stay. And you can see that in the situation of South Korea, there are more than 100 confirmed cases.
Oh wow, more than 100 now.
More than 100 now, and maybe 8 or 9 dead already. But most of them will not, if under medical care, if under good system, we hope that many will be alive. Yeah.
The food, is there anything to do with it, or people in such a situation?
Because during the high fever, during the food is not the key factor, because the body will have reserve. We have food reserve in our body. Yeah. But those who are very weak, that is another problem. The doctor may consider to use some type of the intravenous food supplementation.
For that. You also have, this is for medical staff to be used, but this is for the people. This is the general public to be used. So this is what? This is just to make how do you?
This is just advice for those who travel.
Okay.
And those who travel to and from Middle East, to and from any affected area.
Okay.
So, and then advice, if you have fever, cough, or respiratory symptom, or sore throats, and when you come back from the affected area, please contact us. You can call us 1422.
1422,
Yeah,
1422 for
Actually, there are
the website.
at least 10 people already call 1422.
What did they, on what? Why did they call you?
The first one is consultation. I have come from this, I have this, I voluntarily to notify you.
Oh, nice.
Okay. And then, can I catch MERS? Something like that. Yeah.
Okay, that is kind of a responsibility of
Yes,
the Thai
that is
people for
responsible citizen.
Citizen, very
Yeah,
good,
yeah,
very
responsible
good.
citizen.
And you also have website here.
Yes.
And you can easily get into it with the website here.
Yes.
Very interesting. Very interesting. So, I would like you to have a minute to talk to the people and how today to prepare themselves, how to avoid it. Please do.
Yes. The first one, get yourself ready. Let's get information and also carefully digest the information. Yeah. Do not be overly become concerned because the MERS coronavirus cannot spread easily.
Oh, not easily.
Yeah,
Yes.
actually, when you travel to the affected area and even go and come back, contact the health officer if you have any symptom, and you follow the instruction, follow the advice of the Public Health Ministry. And when you go out of the country, and or even you are expat living in Thailand, or somebody living in Thailand, when you have the health problem, you contact to your embassy people, and then they will simply can contact to us, and we can say that communication and cooperation will help to make us solve this problem. It is all anyone problem.
Yes, it's not any one problem. Yes.
It's all the problem for all of us. Your health is our health. Okay, and then we wish you good health. And when you go to travel, we do not prohibit any traveling. Yeah, so you can travel
to those countries.
To those countries. You can travel to Middle East, to Pilgrim. You can you can go whatever you want to go. You can go to even South Korea.
Okay.
But we just have advice a little bit. Just avoid to go to hospital.
Okay. Crowded area.
Just avoid hospital. Just avoid to go to clinic.
Okay.
And right now they also announce the place that have patients.
Okay.
So you don't go to that place.
All right.
And then you have alcohol gel with you. Alcohol gel with you.
Easy to put in
and
your pocket.
Yeah, your pockets. And if you don't have alcohol gel with you, you wash your hand frequently.
Every now and then, frequently.
Okay.
Yeah.
And then another thing is to put your mask, buy your mask with you, 5 baht, 10 baht, and bring it with you.
Can save life.
Yeah, and save life. And then when you come back on the airplane, if you had anything, you can talk to the flight attendants. And then when you arrive, you can talk to our health officer at the airport. And then if you have something in the 14 day, take care about yourself. This is applied to many diseases. When come back home, people say that don't bring disease home. You can take it carefully. So stay in your home and then observe yourself. It's 14 days. If anything happen, tell them and tell our staff.
Yes.
And then also tell who are contacting with you.
1422.
1422. Okay.
All right. So Thailand Today would like to thank Dr. Pasakon Akara Sewi, who explained to us for layman terms about MERS virus, and so we can now feel confident that the situation is under control as the preventive measures are in place to deal with the virus from entering Thailand. So, however, do take health precautions seriously and take good care of yourself, especially if you are traveling to risk countries. Thank you very much for being here. Thank you much. Thank you for watching Thailand Today. I'm Kusuma Yotha Samut. We hope to see you again tomorrow. สวัสดีค่ะ
สวัสดีครับ